We'll go ahead and get started. Good morning. My name is Dr. Meredith Adkins, and I'm an assistant research professor at the Institute for Integrative and Innovative Research, or IQDAR. Driven by purpose, our mission is to pioneer solutions to wicked problems through convergence research across academic, industry, government, and nonprofit sectors to make a positive societal impact by creating and deploying innovations at scale. Our bold vision is to be the recognized leader in convergence research for societal impacts and the preeminent partner in creating and deploying comprehensive, transformative, and scalable innovations that stimulate economic growth and improve health and well-being in Arkansas and beyond. There are 5 words or ideas that we use to define the Institute: integrative, convergence, economic development, at scale, and societal impact. And this morning, it's my pleasure to introduce this morning's speaker, Dr. William Masters. Dr. Masters is a professor of food policy and economics at the Friedman School of Nutrition at Tufts University. He is a co-author of the new textbook, Food Economics, Agriculture, Nutrition, and Health. Dr. Masters also leads the Food Prices for Nutrition project that computes the cost and affordability of healthy diets, and the Imana Fellowships program, among other initiatives. He is the former chair of the Friedman School's Department of Food and Nutrition Policy, former editor-in-chief of the journal Agricultural Economics, and an elected fellow of the Agricultural and Applied Economics Association, from which he received the Bruce Gardner Memorial Prize for Applied Policy Analysis, the Publication of Enduring Quality Award, the Quality of Research Discovery Award, and the Quality of Communications Award. This is just a snapshot of the many contributions that Dr. Masters has made, and we are very grateful to have him here with us today. And as a personal note, I just wanted to mention as well that I actually first met Dr. Masters several years ago in Nigeria, of all places in the world, where the US Embassy, where I was doing an internship, was hosting Dr. Masters for a distinguished lecture series where we traveled all across the country to many of the very distinguished agricultural institutions that exist in Nigeria. And so it's a pleasure to reconnect. And I'm really excited about the project and work that he's going to talk about with today. And with that, I'll hand it over to Dr. Masters.
Thank you, Meredith, and thanks to everyone for joining, and to IQDAR for setting up this community. So what I'll share is squarely about food and food access. As Meredith said, she and I first met in Nigeria. I'll share some data on Nigeria, but mostly the work on global monitoring of the cost and affordability of healthy diets. This is work that is done jointly with the World Bank and the FAO, you can see on the bottom left, and it's funded largely by the Bill and Melinda Gates Foundation, also the UK government through its FCDO. And I've been able to put a lot of this material into the brand new open access textbook that Meredith mentioned. So if you just Google food economics and my name, or food economics Tufts, you would find this book. And I hope soon just food economics generally, a Google search would lead to this book, because I've tried to put in a single volume the kind of new work that you see here, and also the long tradition of agricultural economics that's been done at the University of Arkansas and many other places around the US and also globally, but not so much in the past on retail food prices. So that's the new thing here, is to think about retail consumer prices that are paid by people around the world in a way that makes sense of global food markets in terms of access to healthy diets. So a new way of measuring. This new way of measuring has changed how we think about global hunger and nutrition. So as you probably know, measuring dietary intake is really difficult. I don't remember what I ate yesterday. Most people, when they're surveyed, are wildly off in terms of what's validated in other ways. There's also food consumption data from total sales, for example. And those get collected in many different ways for different kinds of indicators, metrics, of whether you get enough nutrients, whether your diet is sufficiently diverse, whether the nutritional value is of sufficient quality. And this measurement really began in the 19th century about individual nutrients, early 20th century. Lots of different metrics of food security, of well-being that get used with food data. And people today would measure, all these different techniques. But for global measurement, you need UN system agencies and national governments to set a standard for what people say. So undernourishment or global hunger has been measured by the Food and Ag Organization of the UN since 1974 in a consistent way. This is a method developed in the 60s. It takes the total energy available in all the foods. So you add up all the foods in a country in the food balance sheets of the FAO, and you imagine that it was distributed in this log normal pattern that you might often see. And if that were the case, then there would be about 0.7 billion people, or 9% of the world's population, that are so small, they're thin or short, that they're undernourished relative to a healthy population. Food insecurity has been reported by FAO much more recently, but for the past decade, using methods that were developed in the 90s based on surveys that ask people if a lack of money or other resources to obtain food, to buy it in the market or grow it themselves, caused them to skip a meal, to eat less food, to eat fewer foods, to go to bed hungry, all that kind of question at any time over the past year. So if I asked you, did you run out of money to buy food such that you went to bed hungry or ate fewer foods? Do you answer yes? And about 25% of the world's population, 2 billion people, are food insecure today in this specific sense. What's new is the cost and affordability as a way of measuring access. Could people obtain a healthy diet? Food insecurity is with respect to their usual diet. Undernourishment is with respect to calories. So what we're doing now is with respect to an overall healthy diet. And I'll share how that works, what it is. This is brand new. Since 2020, using the least expensive, the lowest cost, locally available items in each country, in each place within a country, for an overall balanced or healthy diet relative to the money you have available. And about a third, 35% of the world, 2.8 billion, cannot afford a healthy diet in this sense. So my point is that we've developed metrics that are more ambitious over time because we can reach them, because we have the agricultural development technologies, institutions, assistance programs that can achieve these goals. So it makes sense to keep raising the bar towards something that's aspirational for many, many of us. Having a healthy diet is difficult, even if you're in a rich country. This is a goal that is, far from being met in the world, and we know that, and we want to help people aim high as well as eventually reach this more ambitious kind of goal. So the metric is designed to identify remedies. The purpose is diagnostic, not just to tell you that you can't afford, but to tell you how you could afford, how a country could make healthy diets more affordable. So in particular, if we observe that prices for the least expensive foods are unusually high in a particular place, that is a production or distribution problem. That requires agricultural innovation, better transportation, storage, and so forth on the supply chain. If incomes are too low, then people need employment, livelihoods, income growth, and also assistance, something like SNAP or WIC, when they have illness in the family or some other reason why incomes are too low. And if unhealthy items are displacing items that we find are low cost and would be part of a healthy diet, then we need to ask, why is there displacement? So this reveals very clearly what is the agenda for food system change to bring healthy diets within reach of everyone. So the big discovery that we made, the new thing that was not previously known, I did not know, and knocked my socks off to find out this, is that if you take the least expensive items in every country, you multiply them times the quantities you would need for a healthy diet, that costs something between $3 and $4 a day. In the red, you see that it's similar in all income levels. On the x-axis, you have the poorest countries in the world, mostly in Africa here. You have the richest countries. You can see the US, these are proportional population, so relatively large countries here. You have India and China, and the red dots are roughly similar levels between $3 and $4 a day in this range. at all income levels. But actual food spending, of course, is very, very low in the poorest countries, much less than their healthy diet would cost, because people here are consuming just a big pile of grains and a little bit of beans and a little bit of oil, not the fruits and vegetables and animal source foods you would need for a healthy diet. And over here, people are consuming much more meat and expensive products, often ultra processed foods that are much more expensive than the basic healthy diet that we're looking at down here. To track affordability, we need to compare to income and think about income distribution minus the non-food needs. And the way this is done for the State of Food Insecurity in the World report, the global UN agency report, is to allow higher non-food needs in higher income countries. The way this works is that each country in the world is classified by its income level in the World Bank classification, and the average of the national government's poverty lines creates the international poverty line. International poverty line is specific to different income levels, and you might have heard this was originally $1 a day when this method was first invented back in the early 1990s, and now it's $2.15 a day. In the lower middle income countries, like India and so forth, $3.65. In the upper middle income, $6.85, and in the high income countries, $24 a day. In the US, I think the poverty line is roughly at that level, actually. I haven't looked it up recently in dollars per day terms. This is in 2017 dollars, not 2024 dollars of today. So in 2024 dollars, this would be quite a bit more, maybe $30, I think, per day if you projected forward from 2017 to 2024. The non-food expenditure share that's observed for the poorer parts of these countries, so the second or first quintile, the poorest 20% or 20 to 40th percent of people in the country, give us the non-food spending, the housing, education, healthcare, transportation, clothing, energy costs that low-income people who are at these poverty lines are thought to need. And if you multiply the share of spending on non-food times those poverty lines, you get the implied required non-food spending that we have to subtract from a household's total income to get income available for food. So you can see that in low-income countries, what this method does is say they really, to be a non-poor person in a low-income country, you don't need very much. But to be a non-poor person in a high-income country, you might need more energy, more housing, more healthcare, more education in order to be a citizen of that country. So with this method, we get this result. The UN estimate announced in July of 2024 is that 2.8 billion people could not afford a healthy diet in the most recent available year. So you can see the circles are showing you that the largest group of people are in Asia, but the largest number of countries and quite large numbers of people and countries with a high share of the population who cannot afford, those are the low-income countries of Africa. Even in the US, Mexico and so forth, there's significant numbers of people who by this method cannot afford a healthy diet, because when we do surveys, we find significant numbers of people with very, very low incomes, often in very remote places, even in high income countries. So what are we doing? We're thinking about not just survival for daily energy, not just nutrient adequacy, but overall healthy diets that meet dietary guidelines like America's My Plate. And then above that, of course, there's food preferences, convenience, many other goals. So we introduced this in 2018, thinking about the cost of diet diversity. And then we have more than 20 studies trying to get these metrics with least cost items to give us a benchmark of affordability. This was attractive to policy because it gives us a global measure of access to healthy diets. So introduced, as I mentioned, in the State of Food Security and Nutrition in the World report for 2020. And then we adapted the method for 2022, and then we updated the method for 2024. So there's continuous improvement. And if you're interested in this kind of work, definitely be part of the development of better and better methods. So what you see is higher costs for the healthier diet standards, and actual foods, of course, in rich countries, much more expensive than that. These come from not just the US MyPlate that I hope you're all familiar with, but every other country that has a similar dietary guideline in terms of the share of the diet that should be in all the different food groups with bioactive compounds that you would need for health. So it's not just micronutrients, but also the flavanols, the antioxidants, the fiber and other attributes of foods that make them what you would need for an overall balanced and healthy diet. The goal is to think about access where you can have substitution within the groups. This is really crucial because you don't need, well, in different countries, different settings, you might have very different fruits, different vegetables, different animal source foods that are available. And to allow substitution, we convert volume and weight that's used in the food-based dietary guidelines to communicate with people, a number of servings, a number of cups, number of liters, number of kilograms or grams, ounces, pounds. We convert all that to share of your daily diet. This is really fundamental. When we think of a diet and how much food is in any food, we measure that. We don't think of it, we think of it in terms of cups or weight or volume. But if we think of it once you've swallowed it and you've also had a glass of water, all that matters is how much food was in the food, and the food content net of the water weight is the calories of that food. Of course, you don't eat vegetables for the calories, you eat vegetables for the nutrients, but if you want to know how much tomato is in a bit of tomato, you would just use the calories of tomato because that tells you net of all the water how much tomato is in the tomato sauce or tomato concentrate, or the more watery tomato versus a cherry tomato has very little water. You know, a great big tomato has a lot of water. And so you net out all that by thinking of the calories of tomatoes. And we take the least expensive calories of any vegetable, and sometimes that's a tomato, but more often it might be a carrot or onion or broccoli or green leafy vegetable, for example. The quantity of each food group that's needed can differ between dietary guidelines and can change over time. For the original method, we used the median cost of 10 quantified diagrams, the 10 diagrams you see here. But additional countries kept publishing new dietary guidelines. So the method was adjusted to take account of 31 different guidelines, each of which has a food guide that looks like this. And for SOFI 2024, we use the updated price and income data, but the same health criteria. So if you're working in this area, you could innovate in many, many different ways in terms of better price data, better income data, better potentially health criteria as well. Here's the current method. It's calling for the least expensive 11 items across 6 food groups, where the balance of the items you see on the MyPlate or any other in terms of calories is that a representative person would have a dietary balance, energy balance at 2,300. And that would be, for the WHO reference population, roughly the average of all the age sex categories in a healthy population. It's also the level of the median adult woman not pregnant or breastfeeding in the WHO reference healthy population. And so that representative level of daily energy balance would be met with roughly half of the energy coming from the starchy staples up here, or around here in different food-based dietary guidelines. Around half the energy comes from that. Not much energy comes from vegetables, but it's a lot of the plate and a very, very large fraction of the nutrients, even though it's few calories, a lot of the nutrients. Similarly with fruits, and then roughly similar amounts of the animal source foods, which in this healthy diet basket could include dairy or fish, as well as eggs or meat of any kind. Legumes, nuts, and seeds plays a very big role in health, and almost all countries in the world, people under-consume them relative to the dietary guidelines that you would see here, for example, and then oils and fats. So this gives you the energy shares that is the target, and you can also see other ways of thinking about this balance. But in order to do it in terms of cost, we use just the energy shares. Nigeria, I'll share you the data. They're the first to publish national statistics using this global standard. And other countries publish the cost of meeting their own national dietary guidelines. So here's the items that would get chosen, just showing you here in the global comparisons, the cost shares around in a circle of each food group that's used for the global diet cost monitoring. Start with the example of Pakistan, where the animal foods are buffalo milk and a live chicken, wheat flour, maize, red lentils, vegetable oil, onions, carrots, and a green leafy vegetable, and then bananas and coconut are the fruit. Go to another very different low-income country, you get sardines and small fish that are dried. That's because Senegal is, of course, at the coast, but also a place with very little refrigeration. So small fish is way better than buffalo milk, and they don't have much feed for livestock. So dried fish is overwhelmingly the least expensive animal source food here. You also see that it's a different legume, nuts, and seeds. Ground nuts are grown widely and are low cost in Senegal. And similar vegetables, but different fruits, dates and mangoes, very dry climate in Senegal, in contrast to bananas or coconut in Pakistan. In a rich country, in Italy, boxed UHT milk. You might know Italy is the country, the home of Parmalat, frozen chicken instead of the live chicken from Pakistan. And in the US, dairy is really cheap. And so whole milk, semi-soft cheese are the least costly animal source foods. So a first point to make about costs within food groups is we're often looking for data on environmental sustainability. And we are very keen to think especially about climate mitigation and reducing the emissions from the diet, but also reducing water depletion. So in Arkansas and much of America, water depletion plays a huge role in the sustainability of agriculture. Many parts of US agriculture will have to move on to different regions because of depleting their groundwater. Other regions in America are very successfully maintaining their groundwater. But the amount of overall water footprint is shown in this diagram, and total carbon equivalent emissions, whether methane or carbon, is shown here by cost level of the diet when different items are used in each food group. So the red is animal foods, legumes, nuts, and seeds, fruits, each of the food groups, and the brown is discretionary sugars, sweets, and candies. And what you can see is that with respect to emissions, the lower cost items, and in each country it's the least cost item that makes that healthy diet affordability, those are lower emission foods. They're lower emission foods because they use less resources. That's why they're cheap. So that means less land, less transport, less everything went into them. The higher cost items per 100 calories in this case have more emissions because they use more land, more resources of all kinds. So up here you have essentially all types of red meat. You have essentially all very high cost, specialty products that are just use a lot of resources to make them. That's why they're expensive. And so within any food group, to have, and the same is true, by the way, for water, the lower cost items within a food group use less water. Of course, between food groups, animal source foods use by far the most resources because you have to raise the whole animal in addition to the food that you get from it at the end. But high cost vegetables in green also have quite high impacts on the environment. And so the lesson is that within foods, you can obtain a healthy diet with the low sustainability by essentially buying the lowest cost items available in your market. So if you look among all animal source foods, buy the cheapest ones, those would be the most sustainable in general. But that's not really true in terms of health. So on the right, you have some health criteria. Within food groups, foods differ a little bit in their food compass scores, 0 to 100 scores on the y-axis. You see that the least expensive oils are actually the healthiest. Those are plant-based oils. The more expensive fats or animal fats, and then you have things like olive oil that are expensive but healthy up here. And then, so all these these are all low cost oils are quite healthy because they're just the plant-based ones. Um, and so choosing less expensive foods sometimes gets you healthier, sometimes doesn't get you healthier. These are not linear curves the way these are consistent in their direction. So you can't really use price as a guide to nutrition. You have to read the label, but you can use price as a guide to sustainability. The lower cost items are more sustainable, but they're not necessarily healthier. So least cost items within food groups get you the most important aspects of health. As you can see, the different levels of healthiness differ greatly by food group. Just food group tells you most of what you need to know. But within food groups for sustainability, the lower cost items are the more sustainable. Looking within countries, we get these new data from the National Bureau of Statistics in Nigeria. So their monthly bulletin, as part of their national statistics, show how the least cost locally available healthy items across regions within Nigeria vary over time. And this is their monthly bulletin. The most recent one is for July. What's really striking is this is the national average cost of a healthy diet. And you see, this is a period of very high inflation in Nigeria today. One reason why they put out this bulletin is because they're having an inflation crisis like the United States did in 2022, when in the US, of course, grocery prices spiked up in 2022, and they've come down a little bit and have stayed without further inflation for the past year very much, but not so in Nigeria. In Nigeria, they've had a burst of inflation that you see here. Overall average price levels up about 30% over the year, a bit more than over in the US than had been in the US in the 2022 inflation spike that we had 2 years ago. But in Nigeria, the least cost items have risen much more, have doubled in cost. And why is that? Well, it's because the least cost items that you see on the right here are these basic foods. When you look at the least cost items using Nigeria's own data, you can see that they're similar to the international least cost items that we saw before, but of course they're specific to their own food system. So millet, cassava, maize are the low cost starchy staples. Palm oil is a low cost oil for them. Coconut, date palms, and avocados counts as fruit in these data. And vegetables a little bit different, but dried green leafy vegetables are the least expensive ones here. Another key insight from the Nigeria data is how the cost level differs a lot from the income available for food. So on the left, you have the cost by region on average in the most recent year for which income is available, which is 2018-19. This is income by household in each region. And what you see on the left here is that the costs are highest at like 320 to 340 naira per day in these higher income coastal states. In these higher income coastal states, affordability is pretty good. The unaffordability, the percent of the population that cannot afford, is over 75% in these you see, these are low cost states up here, but they have very, very low incomes. So we need to appreciate that low cost regions are not places where people can easily afford food. Sometimes food surplus places have low prices, but incomes are even lower. And so unaffordability is very high. So zooming back out to the world, we know that we are not delivering healthy diets to people. That, as we've seen, many people cannot afford these items, they don't choose them, and because they can't afford them or because they don't like them, both factors matter. But here we show the actual food use relative to the healthy diet basket target. So the healthy diet basket targets are the horizontal dashed lines here. They're scaled each of these food groups is scaled in terms of calories per day available in that country, so that the healthy diet basket target is at the same place in each panel of the diagram. Okay, so you can see the healthy diet target, remember, was about half of all calories. Here it's 300 calories for animal source foods and oils and fats, and also legumes, nuts, and seeds. So each of these three have the same scale. And then fruits, the target is 160, and vegetables, the target is 110. And then discretionary, the target here is to stay less than 10% of all the diet. So that's 2,330 is the total diet. So 233 is the maximum that you would want. As Delia has put in the chat, please do note in the chat any questions, comments, thoughts. I'm just racing through all the data because I find this so exciting to have for the first time a sort of a dashboard picture of access to healthy diets around the world. So what do we actually have in the world? Well, the North American diet that we're familiar with has levels of animal source foods off the charts above any other region. We were converging with Europe and Central Asia here, or they were converging to us, rising faster than the US, but then stabilized. And we had stabilized, but are back up in very high levels of animal source foods, far above certainly the healthy diet basket target in my plate or any other dietary guideline. And this, of course, is very expensive. It's also delicious, and it's pretty compelling for Americans. We don't know whether we'll ever reduce these levels so that we can have more of our diet be the healthier foods, of course, moving towards legumes, nuts, and seeds that give healthy vegetable oils, as well as protein and micronutrients. Getting more vegetables into our diet is a huge challenge, and even getting more fruit into our diet is a huge challenge. Then you have at the opposite end of the spectrum, Africa in the green with low use of all food groups below the healthy diet basket target, because these food groups are all more expensive per calorie. So as they've had income growth, to the extent that they've had income growth, it's really been to increase their starchy staple consumption because these higher cost food groups are just too expensive. So we can trace out how these least cost items, the healthy diet basket food groups, starchy staples, legumes, nuts, and seeds, oils and fats, animal source foods, vegetables, and fruits. This chart shows you the cost level for each of the food groups added up to the global average cost of a healthy diet. Remember, just between $3 and $4 a day, in the form of a Penn's parade plot. So it shows the world population by country in order of national income per person. So the poorest countries are on the left, and this is a log scale of cost per day. The total is between 3 and 4 here in the pink, adding up each of the food groups. So just the two starchy staples, that's in the vicinity of 80 cents a day down here. But then on the y-axis, you have national income per person on this log scale, going up to like $250 or $300 a day in the richest countries. The width is the population of the country. So you have India, you have China, and you have the US visible clearly here. These are mostly small African countries, then a lot of Latin American and Southeast Asian countries, and then a lot of European countries over here. But the basic idea is that there's plenty of room for the governments in each country, for the I3R agenda of integrative, innovative research to lower the costs, to learn from the countries that have low costs, so that countries with high costs across the different food groups can reach the sort of global frontier of lower and lower costs that might be available. So when we look at what that frontier seems like, here we show by income category, and this is from our most recent paper, just published like literally today in the Verichive, the verified archive. Verichived is the new preprint archive. This paper will, I hope, appear in Agricultural Economics later this year. It shows the range of costs per day by food group in the low income, lower middle, upper middle, and high income countries. And what you notice is that fruits and vegetables are actually cheaper in low income countries. So these are typically tropical fruits and vegetables, and they're just relatively inexpensive in those countries. They're still a lot more expensive than starchy staples, than oils and fats or legumes, nuts, and seeds. Starchy staples are actually more expensive than some fruits and vegetables, but of course you couldn't have a diet. You couldn't eat just cheap guavas or cheap bananas. That would not be something anybody would ever want to eat. And so starchy staples, even though they're more expensive per calorie, remain the dominant because these animal source foods are just really expensive in low income countries and really inexpensive in high income countries. So that's a really striking discovery that there are these gradients in cost of the least expensive item. And also at the bottom of these charts, and then the higher cost items also have that gradient. So to wrap up, we can just compare this unaffordability measure in the black dots, which is the new thing discovered, published globally only in 2020, and then improved with each successive round of improvements to the current data published in 2024, just published at the end of July of this year. And they refer to 2021 because it takes that long to process all the data. You can see that in 2021, the share of the population unable to afford in the black dots in the poorest countries, 60 to 70, 80% of people unable to afford, in some cases down to 40. You see a lot more variance in this unaffordability than in the traditional. Remember, this was invented in the 60s, published since the 74 World Food Summit of 1974 that's been publishing continuously this prevalence of undernourishment. Now it's about half of people in low-income countries by that metric are receiving too few calories for a healthy population. And then down in richer countries down here, and then food insecurity is much more prevalent. So food insecurity is, did you skip a meal or go to bed hungry relative to your usual diet? And that is prevalent even in the United States. So you see these different patterns that give us a pretty clear conclusion about the world. So remember, the global number is about 2.8 billion people that cannot afford after we subtract non-food requirements, as you saw. And the reason is because these nutrient-rich food groups are just more costly to grow and ship in general. So at times and places where the prices are unusually high, as you saw in Nigeria, for example, there's an agenda for agricultural supply and distribution. Where unaffordability is caused by low incomes, there's an agenda for livelihoods growth or nutrition assistance. And even when healthy diets are affordable, there's overwhelming evidence of large-scale displacement by often less healthy items. So this is because, of course, we think we want food for many reasons other than health, and we often go from inadequacy to excess as incomes rise. What's the big thing? The big thing is overshooting what you need for health in terms of animal source food. So everyone does need some degree of vitamin B12 and other nutrients that are obtained only from animal source foods. Animal source foods have more bioavailability and palatability, especially for infants and children, pre-pregnant girls during pregnancy. Animal source foods are really, really important, but in much smaller quantities than people consume when we're rich enough to do so. Sweeteners and oils, of course, very compelling, even for home-cooked meals. And then when we switch to food service and packaged items, then you have excess salt, refined grains, and many other causes of diet-related disease. So the frontier for future work is to understand displacement as well as affordability. So displacement and affordability really comes down to frontier work, thinking about time use, cost of meal preparation, the role of non-food factors that drive the choice of foods within a retail environment. identifying the least expensive ones and the cost per day is giving us good guidance. Guidance to think about supply, guidance to think about social protection, livelihoods and incomes, and thinking about food choice. So lots and lots of things to think about in terms of health, and also to guide us on sustainability towards less emissions, less water use, and other factors. So lots of things for each of us to think about in our own food choice, because healthiness is just not visible, often misleading, and lots to think about in terms of policy. So I really appreciate your attention now, thinking about this, talking about this. I think we have 15 minutes of conversation. I don't know that anyone's put any questions, comments in the chat yet, but you certainly can. And also take yourselves off mute to just share any thoughts, any reactions that you might have to this. I went very quickly, sharing just lots and lots of data so that we'd have time to discuss.
Thank you so much, Dr. Masters. This is really fascinating, and so many interesting things to dive into. We have one participant who's asked a question in the chat, or sorry, in the Q&A that I'll read. And then after that, I want to ask Dr. Jifeng to come off mute and ask her question live if she feels comfortable. So the first question is, how is sugar figured into what is affordable and sustainable in a healthy diet?
Oh, excellent question. Yes. So in the healthy diet basket, and the cost and affordability of healthy diets measure, the purpose of that measure is to guide food systems towards access to a healthy diet. So there is no discretionary calories included in that. Adding discretionary calories above the 6 healthy diet basket food groups would be the 7th food group of dessert plus snacks. And that would be this 7th food group that the World Health Organization's target for calories from added sugar, from free sugars in general, would be about 10% of that. So while sugar is not included in the healthy diet basket, it would not be unhealthy to add some dessert. But of course,
Great.
actual levels are well above that for most people. So for most people, anything that you can do to cut back on the discretionary food group, as well as above target levels of animal source foods and oils, would help people move towards the overall balance of the MyPlate recommendation.
Yes, thank you. Yes, I've been focused on sugar a lot lately myself, just like the participant, and just seeing how much sugar is added to processed foods, and puts most Americans well over the 25 grams a day added sugar recommendation. Dee, do you want to go next?
You're still muted, actually.
Oh,
there
you go. Okay.
Now it's allowing me to. Thanks, Bill, for this very interesting and much needed research. As I was listening, I was thinking along the most recent dietary guideline, where they also have specific recommendations for different life stages. For example, younger people, older adults. And I was just wondering, and I think the information on sustainability and emission is really cool. And I was like wondering, how would individuals and the government internalize these 2 types of information? The first, the cost of healthy diet, and then the sustainability information, as they clearly have different objective functions, with the government maybe more focused on the externality. So if you could speak to how could both individuals and government use this information for better planning. Thank you.
Yeah, super interesting. When you started with the question of differences by age and life stage, you mentioned the new US dietary guidelines for under 2s. And then we also have, of course, dietary guidelines for the elderly. At older ages, total calorie needs fall as physical activity is reduced, and people then do need a higher nutrient density in the diet. So these are for the general population and not specific age sex groups just per calorie consumed. So more for larger people, less for children. But we also do have a line of work on individualized diet costs, and that's very complicated. But you absolutely could, work in that domain, and I think you would find really interesting variation in many aspects of this. But in terms of operationalizing the findings, I think there's two key lessons. One is that we do overshoot on a lot of healthy types of foods. Like you don't need huge quantities of these healthy types of foods. And the US, you can do well in terms of overall dietary balance, even with more foods in the sort of carbohydrate group, as long as they're whole grains, and as long as they're not, with a lot of added sugar in them, and then less animal foods, both for sustainability reasons and also for cost reasons, to get the cost down, but also for health, to make room for some more vegetables, some more fruits, and then for all of us economically, almost all of us in America, 98% of Americans or so, that is affordable. Like we absolutely could do that if we had the time to do it, had the attention span and the sort of ways, the routines, the family routines that could help us make quicker meals that are healthier. And that's a huge, huge challenge. And then on sustainability, this amazing result that foods that are advertised as sustainable take an existing product and do it differently in a way that might have less emissions than the conventional version of that thing, but it's just a really expensive thing. And so because it's an expensive thing, it uses a lot of resources. So it uses a lot of buildings, it uses a lot of activity to make that fancier version of something that is sustainable. But to actually have low emissions, just buy the low cost stuff. That's a stunning discovery that is in some sense consistent after the fact. After you see it, it makes sense that if you go to your local Walmart and you buy the generic version of something, it was done very efficiently. So the basic generic milk, for example, will have more milk per cow and less fancy packaging, less fancy stuff around it. And all that means that it has less emissions per cup of milk than a, quote, sustainable one that has less milk per cow and more other things associated with it. And that discovery that the low-cost generic is actually the more sustainable is just a mind-blowing thing in a market that's saturated with high premium products that were produced in, quote, sustainable ways that actually involve just a lot of activity, which is itself emitting. So this more complete life cycle analysis gives us a really surprising finding there that applies primarily to emissions and to a lesser degree to water depletion.
Thank you. The next question is, and I'm not sure if your data corroborates this, but the next question is, in North America, the cost for vegetables and fruits is higher than for animal products. Do we have data on income levels and food choices in the US based on the healthy diet guidelines?
Yes, so in the data that I showed, it's not that animal source foods were less expensive than fruits and vegetables. It's that relative to low-income countries in the US, animal source foods are cheaper than they are in low-income countries. So in the US, we have very low-cost dairy and relatively low-cost meat compared to low-income countries where those items that require refrigeration and so forth are more expensive. Whereas in low-income countries, just getting mangoes, bananas are really abundant and low cost in tropical low-income countries. But the question asked about, evidence about consumption. And yes, in the United States, people consume far below US dietary guidelines recommendations for vegetables, especially. Also, other food groups, including fruits, but mainly it's a vegetables thing. And then we consume off the charts levels of animal source foods, far above what the dietary guidelines recommend. And we consume that primarily in high cost animal foods. So, and we consume it primarily in high emitting animal foods that are high cost, especially beef. And the big question for global agriculture in terms of sustainability is, can we find a way to have really fun, delicious, easy meals that don't rely so much on meat, especially red meat, but also chicken and pork?
Thank you for that clarification. And I definitely have a really tangible, vision of both Senegal and Indonesia, and just fruit, kind of growing everywhere, especially mangoes in Senegal. And so, of course, mangoes are really cheap because they're literally everywhere.
In season,
yeah, which we just don't have in the US. So thank you for clarifying that. Dr. Subaya from our food science department also wanted to clarify, you mentioned that ultra processed food is more expensive. Is that correct? And can you kind of go into that a little bit more? And Dr. Subaya, feel free to come off mute if you want to dive into that anymore.
Yeah, any clarification for the question? It's Dr. Subaya. Thank you for joining. And it's a really important question. I mean, I could just go ahead and say, yes, it's more expensive per calorie than the generic base ingredients. This is true for essentially all ultra-processed foods, that they're more expensive per calorie than for the base ingredients. But the least expensive calories in terms of ingredients are always a basic starchy staple, or oils or sugar that have less micronutrients per unit of calories. So whether it's sugar, oil, or a starchy staple, it's roughly the same cost per calorie around the world, approximately. And of course, those added ingredients, adding oil and adding sugar, lowers the cost per calorie of anything you might have. So if you start with fruit, start with vegetables, and you just add a little sugar, add a little oil, then you get a lower cost per calorie of that thing. So lower cost versions of, so if you have a can of baked beans, a can of baked beans with a lot of added sugar is going to be less costly. Well, that's not a good example, because that's not an ultra processed food. It's a minimally processed food. If you take ultra processed crackers or biscuits compared to minimally processed crackers or biscuits, and you add more oil, it might get so the basic point, though, is that these ultra processed foods that are so compelling, they're ultra palatable, and they're heavily marketed, so they're very aspirational foods, as well as being in really terrific packaging, often very convenient packaging that's very attractive. So with the marketing campaigns, the packaging, and of course the taste attributes, and the shelf stability of those ultra processed foods just makes them super compelling. They also often have they typically do have less moisture and less fiber in them, and so you can scarf them down really quickly. And that's the main result of the famous Kevin Hall experiment, where ultra-processed foods was compared to non-ultra-processed food. People just ate faster and therefore ate more, and therefore gained weight in the beginning of the trial before they figured it out. So the fact of this compact food without moisture, or with less moisture, and with less fiber, means you can eat it faster, and it's hyperpalatable, shelf stable, etc. So it's not because it's cheap that people eat a lot of it, because it isn't cheap.
Thank you. And Dr. Subaya is not able to come off mute, but thank you for
Sorry.
answering that
Thank you.
question for him.
I hope that answered the question. Of course, they're cheaper than fancy versions of healthy foods, because a generic mass marketed food is cheaper than a premium product marketed to a health conscious consumer. So in the grocery store, there are, first of all, grocery stores where everything in the store is advertised as healthy, and that's a premium store. And then there are, within any store, items or brands or ranges of items that are marketed towards the more affluent, more health conscious, more attentive consumer who has more time and resources to devote to seeking health, those are going to be premium products. So you will pay more for a healthy food, just like you would, might want an outdoorsy car like a Range Rover that's an outdoorsy car, but it's not truly healthier because just buying regular vegetables, even plain frozen vegetables is perfectly healthy. You don't need to buy the premium product to get health. That's the central insight on the health side of all this least cost healthy diet work, is that those generic items in the healthy food groups are exactly what you need to meet dietary guidelines and nutrient requirements. You do not need, quote, healthy foods, you just need healthy foods.
Thank you. And as we close in on the hour here, I'm going to just combine the final two questions. The first kind of set of questions is really on data and quality of the data, alignment of the data collection to the goals of your analyses. And then a related question was about if you have also seen any healthcare data, which might have interesting trends correlated with the data presented today.
So matching up to healthcare data is a huge challenge. And many people, I imagine, on this call are actually working on that as part of iCubeDAR in the United States, where you can gain access to healthcare data. But I have not seen anything like that internationally. And in the first half of the question, I'm not sure what you were asking exactly. Can you rephrase?
Yeah, so this participant asked how granular is the data, individuals, community
yes.
level,
Yes.
and just anything about alignment of the data. And I think really how happy you were with the alignment of the data collection to the goals of your analyses.
Oh, excellent. Yes, great question. So here, the diet cost data are at the level of granularity of a marketplace. So it could be done and is sometimes done for an individual retail outlet or a wet market, an open air market, a farmer's market type place. But you're asking at that farmer's market or that grocery store, what is the least cost items that would meet dietary standards? So at the level of a market location, the data are actually collected by government agents who go to an actual grocery store, supermarket, or a farmer's market, wet market type place. That's the level of granularity of observation of diet costs. Those then get averaged up to the average cost I showed you data for the states of Nigeria, and I showed you today data for entire countries, so the national average or the average of the states within Nigeria. And then these data are also available and get used at the level of an actual town or district in a rural area. And you could do it for an individual retail outlet. We've done it, for example, for home delivery in Boston. So the least cost from any retail outlet, but for home delivery to a given address. That's another way of thinking about the food environment. So these diet cost metrics are for the food environment, meaning the place, not the person. But then affordability is for the person. So affordability is based on income surveys of households and then getting the income distribution in a given country. So the granularity is for a place on cost of a healthy diet and for a person on affordability.
Well, that actually is our time for today. And so thank you for answering multiple questions that participants had. And we just really want to thank you for coming today. It was an excellent and very interesting talk, very timely considering the challenges we're having here in Arkansas around food access and food insecurity. So really relevant to our region. And as Delia put in the chat, we hope that everyone will join us for our next speaker series on October 4th for an engaging conversation on healthcare initiatives with several of our faculty from the Hamilton College of Business. So thank you again, Dr. Masters, and thank you for everyone for coming today.
And thank you. Thank you. Take care. Have a great rest of the day.
You too.